Hi, I am Nitin Agarwal, part of the product management team at Health Cloud. Today I am going to talk about the exciting new feature that we are bringing in Summer 20 release sales visit and inventory management. Let's just jump into the feature. Sales visit and inventory management for Health Cloud helps and empowers medical devices sales reps to ensure every surgical case visit is a success. Sales visit management not only allows to plan and schedule visits, but also help maximize on-site productivity with visit and task management from mobile device. Field inventory management empowers sales reps with the field inventory management tools to ensure you have the right products and resources at every visit. Using field inventory management, you can gain visibility into inventory availability at field locations across roles sales reps, managers, analysts, or sales operations. Sales reps can now proactively plan and close product gaps with inventory insights and request transfers and replenishment orders. With sales visit management, sales reps can create and manage sales visits and add associated medical devices, attendees, and internal resources. Sales reps can now go ahead and plan their day, execute predefined tasks like order authorization during a visit using flows which can be customized for each business. We will be now going over a demonstration for intelligent sales for medical devices. The demonstration focuses on the sales rep persona. From the home page in Health Cloud, sales reps with new product level insights can now review any projected shortfalls across all unique products for upcoming visits, including product details, revenue at risk, and date. Sales rep can also view the data by total transfer requests coming in and out of across all products and locations. From the home page in Health Cloud, sales reps can view their upcoming visits and important notes about projected products availability for each visit. Sales rep can now proactively manage their inventory availability for the visit. You can see the products required for the visit along with their projected availability. Sales rep can proactively manage product shortfalls by requesting transfers. Sales rep views the projected availability of product on the date of visit across nearby inventory locations. Sales reps can select an inventory location and request transfer on product shortfall from the selected location. With sales visit execution, sales reps can view their surgical case visit details on the go from any device. Sales reps can now successfully execute visits with predefined tasks and out of the box flows that can be customized to your business to maximize productivity. To execute a visit, sales rep would start the visit and then select the predefined task to execute. Using out of the box flow, sales rep can execute the task for order authorization as part of the visit. To create order authorization, sales rep selects the products which were consumed in the visit along with the quantity consumed. Sales rep can select the authorized signatory from the customer contacts for the visit. The authorized signatory can provide their e-signature authorizing the order. We are now at the end of the demonstration. That's it from me. Thank you for being part of this. I'll now hand it over to my colleague Matt.
Hi, this is Matt Yo. I'm with the Health Cloud product management team. Today, I'm really excited to bring to you our latest in the Summer 20 release on device registration and care program enhancement. Let's jump right in.
Let's first discuss the enhancements made to care programs in Summer 20. We made a few additions to care programs. We're giving our customers a system administrator org preference for added flexibility to allow the creation of more than one care program enrollee record of the same person account, lead, or user record for that care program. This will allow your users to enroll the same patient or account multiple times into the same care program. One thing to note is once this feature is enabled, it cannot be disabled. We introduced the provider relationship data model over the last few releases. In this release, we link care programs to provider relationship by introducing a new entity called Care Program Health Provider. Now you're able to link a care program provider to a healthcare professional. In summer 20, for Health Cloud customers to better engage and closely monitor patients, we're introducing device registration and shipping requests. My other colleague in Health Cloud will cover the remote monitoring feature after device has been registered or shipped to a patient. Let's take a look at the data model. A registered device can be registered to a patient directly or through a care program. We're using our standard products to represent a device type. Once you've made device type accessible, a device can be registered as an asset. A device can be shipped to a patient as well in many instances, and we use product request line item to capture where the device will be shipped to. The care registered device is the new object that keeps track of who the devices has been registered to. A case manager working on a patient enrollment can easily register a device to a patient through a configurable flow called register device and create shipping request. This flow template can be added to your existing care program enrollment process, or it can be standalone by itself. During the registration process, the flow will ask to first select a device. The device or product can be filtered down based on the care program, or if a care program does not exist, it will display products that can be filtered by a standard list view. Once the device is selected, a customer can choose to configure if they like to register the device or to request for shipping, or both, followed at the same time. This can be configured in a flow as a design attribute. The device can be registered to a patient by adding a unique identifier on the device in the registration screen, or if a patient would like to have a device shipped to them, they can select the device shipping request to auto-populate the shipping information from the patient's record to the shipping request and can create a separate process to register and physically ship the device to the patient. Let's take a look at a demo. I'm logged into Health Cloud as Jane, an enrollment specialist for Provo Farm. Her patient, Charles, had just called into Provo Farm's patient services program to get enrolled. After the enrollment, Jane notices the program also requires Charles to be given a Fitbit as part of the enrollment process and proceeds to do that. So she navigates to Charles's patient record through the All Patients view. Click on Charles's record and is ready to register and ship the device to Charles. She clicks on the Register and Create Shipping Quick Action button to start the process. She goes to the stockroom in the back and pulls the physical Fitbit Charge 4 Storm to be ready to register and ship to Charles. She selects the right device and clicks on Next. She enters the unique ID from the box and verifies that the information is correct. She creates a shipping request with a single quantity that she will send to Charles. She confirms that the address is the right address from Charles, clicks the Save button, and prints the physical paper with an envelope to send to Charles. She completes the process and hangs up the phone with Charles. She notices the device is now registered to Charles, where the remote monitoring process will pick up once Charles receives the device and start syncing his mobile app with his Fitbit. She confirms to the shipping department that the device is now shipped by viewing that information in the product line item. This concludes the device registration demo flow.
Thank you for listening. Over to you, Catherine.
Hi, my name is Catherine Pujol. Today, I'm going to be talking about our new feature, Patient Remote Monitoring Exception Management, coming out in the Summer 20 release. Let's dive in.
In Summer 20, for Health Cloud customers to better engage and closely monitor patients, we're introducing remote monitoring exception management. This portion of remote monitoring is built independent of device registration and shipping requests, but it can be used in conjunction. We have built care observation charts for care coordinators to easily identify exceptions or gaps in a patient's biometric data. Customers can automate engagement processes such as sending notifications proactively to patients or auto-creating tasks for care coordinators to follow up with patients on when exceptions in device data occur. Customers can set up universal biometric targets, such as blood glucose, to be applied to cohorts of patients, while care coordinators can create more personalized biometric targets, such as those for weight, for each patient. For this initial release of remote monitoring, we have specifically focused on exception management from the point of view of a care coordinator. It's important to note that for this release, raw data is intended to be stored outside of Health Cloud. Customers should configure their external database so that only relevant signals are sent to Health Cloud, so that care coordinators can efficiently and effectively leverage it to engage patients proactively to improve outcomes. Let's take a look at the data model. Before remote monitoring of the patient begins, it's important to set up what type of metrics you want to measure for the patient, indicated here by the code set object, and the goals you want to set for the patient, indicated here by the care metric target object. For example, for a patient in a weight loss program, the code set would be weight, the unit of measure would be pounds, and the care metric target would be a range of 150 to 160 pounds for the month of July. The care observation object is the device data that is flowing in from the external database. In order for a care observation to be mapped to a specific patient, it must arrive with the patient ID or an asset ID if the device is registered to the patient. Once the care observation arrives, the expected value references the relevant care metric target. It subsequently runs logic to determine if the care observation value meets the expected value. The outcome is displayed in the processing result field in the care observation object. Based on this outcome, customers using Process Builder can configure next steps, whether it is to create a task or care gap for care coordinators to follow up on, or it is to send a notification to a patient. Let's jump into the demo. I'm logged into Health Cloud as Matthias, a care coordinator from Bloomington Health. Matthias's patient, Charles, previously was enrolled in a weight loss program in which he was given a Fitbit and a scale. It is important to note again that a registered device is not required for remote monitoring. Device data can be mapped to a patient via the patient ID. In addition, as a part of the care program, care metric targets have been set for Charles, some personalized and others that are generic to all patients. As Matthias begins his day, starting to work through his tasks, he sees a task that indicates an exception for Charles has occurred and requires follow-up. He clicks the related care observation to better understand what caused the creation of the task. Looking at the care observation, he sees it is regarding Charles's weight, indicated by the code. He can see that Charles has a max expected value of 248 pounds, but currently is 250 pounds. It is important to note here, once a care observation arrives, there is a lookup done to the care metric target to find the corresponding expected value. Once updated, logic runs in the background to compare the care observation numeric value to the expected value to determine the processing result. Now, Matthias wants to know how Charles's weight has been fluctuating over time, so he clicks on Charles to view his patient profile and navigates to his remote monitoring data. Looking at Charles' remote monitoring data, Matthias sees that in addition to weight, Charles is also recording his step activity. Matthias can see the weight care observation in blue and the expected value plotted in purple. He can click to view the last 30 days, and it becomes evident that Charles has been exercising less than expected, and that could be driving the weight increase. He then clicks to view the last 90 days and sees that Charles had a dip 2 months ago, but was able to recover. This context will be helpful for Matthias when he engages Charles. Seeing Charles's device data over time and in conjunction with other biometrics allows Matthias to now proactively engage Charles to have a well-informed and more meaningful discussion to help him get back on track. And that concludes the demo. Thank you for your time.
Now over to my colleague Manish.
Thanks, Catherine. Hi, folks. This is Manish Jayandani, and I'm excited to be here to talk to you about the new capabilities that we're releasing as a part of the Einstein Analytics for Healthcare application as a part of the Summer 20 release. So let's jump right in. First, a quick recap. We launched Einstein Analytics for Healthcare application at Dreamforce in 2019. Built on top of industry-leading Health Cloud and Einstein Analytics Cloud, the application delivers comprehensive, actionable insights for payers, providers, and medical device companies. It delivers prepackaged industry standard descriptive and predictive analytics for strategic, operational, and tactical insights. Let us dig deeper. Einstein Analytics for Healthcare delivers key insights to payers, providers, and medical device companies. With the Summer 20 release, we are excited to announce new Visit Analytics for medical device companies. And that is not all. We are also enhancing utilization analytics and care performance analytics. Let us further explore these areas. With Visit Analytics, sales representatives at medical device companies can gain key visit insights to ensure that the right product needed for a specific surgical visit is available at the right time. With account insights, they can identify opportunities to expand the product portfolio into an account to increase revenue, account satisfaction, and retention. With team insights, sales managers can gain insights into the performance of their teams, manage key account relationships, and guide sales representatives to deliver the best service to their accounts. Care managers at providers and payers can get an overview into the performance of various active care plans. They can gain visibility into how many patients are enrolled in different care plans, how many are falling behind on their care plan adherence. They can also segment patients enrolled in various care plans by age, risk band, number of conditions, enrollment type, etc. Care managers can also analyze care coordinator workloads. Provider care request analysis give utilization managers visibility into the care request volume by providers. They can gain insights into providers that are the top submitters of care requests, different care requests submitted by them, and the open denial and rejection rates for these providers. And that's a wrap. Thank you.